Hi, I'm Dr. Audrey. With me is Dr. Charné again today, and today we're going to have fun.
Yes.
We are going to compare our old photos to now. And it was quite an interesting thing to have a look back at your old photos and just think how
far
in my
you've come.
case, how 20 years has gone by, and in your case, two. Ish. All right, you can start.
Oh goodness. I've got two old photos here. This one is just 3 years ago. And even though I think I look fine there, if you look at my skin, I definitely was struggling with hyperpigmentation as well as a dry skin. And the one probably caused the other. And with that also something I specifically want to speak about is around my eyes, and where you can see fine lines, but also if I smile, how my eyes actually close. Here's another old photo of 2 years ago with quite a bit of hyperpigmentation on the nose, the cheeks and the forehead, and then again the eyes, that especially on the left where it wants to close when I smile, with fine lines forming, not static lines but still the laughter lines were there. And I remember in this time my face would always be a little bit red, a little bit dry and scaly, and then of course the hyperpigmentation from sun combined with hormonal hyperpigmentation. So what I've done to change that is I've started a nice skincare routine with 5 steps in the morning and 4 steps at night.
Well done.
So I included a nice micellar cleanser. I stopped with my gel cleanser that dried my skin, and then I started salicylic acid toner because I was also struggling a bit with breakouts. So that toner helped to set the pH and helped with exfoliation and then the acne.
Well done.
And of course my vitamin C in the morning for the antioxidant effect of the sun, for preventing aging, but also specifically hyperpigmentation. And the vitamin C that I'm using has French pine bark in, so it improves the hydration of my skin. So a hydrated skin also looks more shiny, or luminous, I would rather say. And then something else in my routine that I did was I added vitamin A at night, and a nice moisturizing cream that was not too oily, causing acne, but was keeping my phospholipid layer healthy. With that, I combined CBD, which is good for collagen, pigmentation, and for the redness and soothing of my skin. Then professional treatments, which changed my skin probably the most, was DIVL laser.
Absolutely.
For pigmentation, and that changed it a lot for me. So the next photo is recently, maybe a month ago, where my skin looks much more even, it looks healthier, more luminous. And if you look at my eye, when I smile, my eyes seems more open and there's no fine lines on the side. And that was due to anti-wrinkle injections, my friend. That is the skin journey I've gone through in the last 2 years, a skincare routine, laser, and a bit of Botox.
You know what, Dr. Charné, when I looked at that first photo of yours, I thought it looked so beautiful and natural, and when I use the word endearing, and it just really, it's a very attractive photo. So I hear what you're saying, and I was so worried that when you show your after photo, we would lose that. Suddenly we would now have somebody that doesn't draw the eye, that's lost the interest, because sometimes imperfections makes an interesting face. But you've not done that. Actually, you have maintained all of that and enhanced your attractiveness. So well done. And I'm with you. I love the beautiful curves in your face. I love how luminous your skin is, and I love how light reflects off your skin. And I love what that smile in that photo says. It says, no, but we need to mention, it says confidence. And that's what I really, really like about your before and your after photos. You've had it before as well. I mean, you've got confidence, but sometimes it's just nice to show here what we feel here in our heart.
That's true.
I can't emphasize that enough. So you've done anti-wrinkle injectables. Have you done any other injectables that we should know of?
I've had a bit of filler in my upper cheeks on CK1. If you look at this photo, there where the wrinkles are, close to the eye, you can actually see here there's less support of the eye, and it almost wants to flatten down.
I'm with you.
And after a drop of filler in the cheeks, the eyes looks more supported, and that is step 1 of preventing aging and sagging. So a little bit of a lift and defining that cheekbone again.
I love how the lateral brow actually lifted a bit, that beautiful C shape into the cheek. The lateral corner of the eye lifted a bit. I love how I cannot see that you've had anything done. I only see attractiveness and youthfulness. Well done with that. I really, really like that. Well
Yeah,
done.
and I think a big thing about skin is a lot of patients also say that they don't really want to wear a lot of foundation or a lot of makeup. And when you have a skin that's looked after, it looks attractive. It looks like you do self-care, but also the patient feels more confident. And it's nice if you don't have to put so much foundation on because your skin is more even and luminous. So that is my skin journey for the last 2 years. I've come a far way already, and I'm very happy with where I'm at, but it's something that you always have to maintain.
Dr. Charné, thank you for sharing that with us. I really do appreciate that. It's lovely that we can relate with everything that you've said today. Thank you for that.